dental floss. I will be also revealing evidence comparing the effectiveness of the water floss and the string floss. So stay tuned, and at the end of this video I will show you a demonstration on how to use the traditional dental floss and as well as the water floss. Today I'm gonna talk about the proven effectiveness of using a dental floss when it comes to reducing the risk of dental caries and gum disease, meaning can it actually help in reducing the potential risk for cavities and periodontal disease. I'm going to be revealing also an insane survey from the American Dental Association on the use of utensils, fingernails, and weird stuff like literal hair that people may have used as an alternative to flossing, and this is documented on their official website. In this video, I'll be comparing the string traditional floss, other methods such as the flossing pick, the Floss Toothpicks, and alternative weird ways such as this wooden toothpick. As per the American Dental Association, the ADA official website, interdental cleaning helps remove the debris and the food stock and the interproximal plaque between the teeth, and these areas are termed as hard to reach by the traditional toothbrush. That is what makes the interdental toothbrushes, and if you don't know, there is an interdental brush and the dental floss an integral part of your dental hygiene routine. Also, the American Academy of Periodontology recommends flossing on a daily basis to be integrated into your oral hygiene routine in order to reduce the prevalence and the severity of gingival, meaning your gums, inflammation associated with periodontal disease. So how to use the regular dental floss? First, you have to take adequate length, measured approximately to be able to wrap it around your middle finger. Now there's all sorts of like very precise numbers and measurements onto how long should the dental floss be, and I'll include them in the description. However, you can just do it by approximation. You're not gonna bring a ruler and measure things. And then you wrap it around the middle finger, okay, until you get a somewhat tight base, and then so it shouldn't be slipping from your fingers, okay? And then you go to the area between two teeth and you gently insert the dental floss, okay? And you form sort of like a C shape against the surface of the tooth, and then you go a little bit of back and forth, and you gently remove the food and the debris and the dental plaque that's stuck in there. And you can do it on the other tooth as well. So this is for the upper. I'm gonna show a demonstration for the lower teeth too. Same idea, very simple. Okay, again, going with the floss gently in. Back and forth, and you can remove the debris into the outside, and try to use a clean area of the dental floss whenever you're going to a different interdental area in order to clean it. So hopefully this was a very simple demonstration. Now I'm going to move into the water floss. So this is a demonstration for the water floss, and most of the products, they technically in a way or the other work in a quite similar way. It's up to you what to choose really. There are some studies that are a bit old, showing in the results that water floss is more effective in comparison with the traditional string floss that I demonstrated. There are some studies that are more recent showing that effectively there's not really a difference in the effectiveness for single use between the water floss and the dental floss. Keep in mind that water floss is a continuously evolving product. There's a lot of competition in that domain. So I do actually believe that it is very, very possible that we may have a water floss that is like far more effective in comparison with a traditional string floss. But one important note on water floss is I would actually recommend it for people that are lacking with the manual dexterity with regard to the upper extremities, the people who cannot properly manipulate the conventional string floss, also people with diseases such as arthritis, who may have a lot of pain just using their fingers in order to manipulate the floss, people with dry mouth. The water floss can definitely be a bonus and help them significantly. A water floss is also very helpful with people undergoing orthodontic treatment or braces, because the traditional floss will not be able to go through the metal wires for the dental braces. So before I talk about this very popular type of dental floss, there's a question: can I rinse and reuse the dental floss? So the ADA does not recommend reusing a dental floss because it may lose its effectiveness and it may carry bacteria back into properly healthier areas of your mouth, which brings me to this. So I don't really, this is a type of dental floss. I do not advocate the use of this. Please use a regular or water floss, whatever you're comfortable with, but avoid using this type, because every time you floss one particular area between two teeth, you're gonna carry like everything, all the plaque, bacteria, and food debris into another interdental space. So I do not recommend this. I hate this too, by the way, because the tip of this may break off very easily. And the problem is, if this tip breaks off and gets stuck in your gums between two teeth, well, then you may end up in my or another dentist's clinic, because there may be an exaggerated response from the body, because even something as small as this or as a popcorn can get easily stuck into the gums, resulting into something called as a foreign body reaction and a very exaggerated response from your body. You may end up with swollen gums. So also avoid using this type of toothpick. As per the American Dental Association website, it's not really what type of dental floss is used, but rather how, which is what I demonstrated, and when should it be used, which brings us to the next topic, and that is, when is it best really to use a dental floss? So should you floss your teeth prior to brushing or after? And also on the American Dental Association website, I saw that there's not really a huge difference between flossing before brushing your teeth or after. What I would personally generally recommend, and this is my own, what I actually do, and that is to floss before you brush your teeth, because sometimes whenever a patient or you may brush your teeth, you may feel that your mouth is clean, and that dental flossing you may feel is not as significant. So that's why floss your teeth beforehand and then brush, just to avoid missing a dental flossing session, because you may actually not floss your teeth afterwards if you feel your mouth is clean, whilst the food and plaque may be still stuck between some of your teeth. So for the best time to floss as per the ADA is the time that fits with the individual's schedule. One important thing that's worth mentioning before I get to the survey that I talked about from the ADA, and that is with regard to the evidence behind the effectiveness of a dental floss, it's best to use this on a consistent, more long-term basis rather than it's showing better results on that in comparison with more of an intermittent use and shorter term basis, like up to a 1 month or a few months. The evidence suggests that when you use it on a more long-term consistent basis, you get a better result. So according to a study done by Ipsos on behalf of Waterpick, which is a water floss company, in consultation with the ADA, here's where I'm going to reveal the weird alternative methods that they found people may actually use to get rid of food that's stuck between their teeth. So the results shown that fingernails were used, folded paper, forks or knives, utensils, safety pins, and even hair. Well, this is pretty weird. So make sure you leave a comment down below, like the video, share it with your friends so they don't end up on a survey similar to that one. And thank you for watching. Peace.